This video is on section 11.4, which is on disorders of the respiratory system. So we'll begin with the upper respiratory tract and the common cold. Most colds are just simply mild viral infections of the upper respiratory tract, and symptoms include runny nose, sneezing, and a mild fever. So there are quite a few different viruses that can cause colds, but the rhinovirus is probably the most common one. Most cases, the immune response can eliminate the virus within about a week, and treatment just simply involves decongestants and anti-inflammatories. We really don't have a cure for the common cold yet, as they're viral infections, so antibiotics are not going to do anything for these. Then we'll move on to pharyngitis, which is inflammation of the throat due to a bacterial infection. And here you can see a lovely photo of somebody's throat that has this particular infection, also known as strep throat. And it's a pharyngitis caused by the bacterium Streptococcus pyogenes, and symptoms will include severe sore throat, fever, usually a higher fever than with the common cold, and white patches in the pharyngeal or tonsillar area. So in this case, because it's a bacterial infection, then treatment would include antibiotics. Tonsillitis occurs when the tonsils, which is a type of lymphoid tissue, become inflamed and enlarged. If tonsillitis occurs frequently and the enlarged tonsils make breathing difficult, then the tonsils can be surgically removed. This is, something that has changed considerably over time. And 50 years ago, just about every kid, before the age of 5 had numerous cases of tonsillitis. And so just about everybody got their tonsils removed surgically. It really doesn't happen that much anymore. You do see tonsillitis from time to time, but it's certainly not the kind of pandemic that it was like 50 years ago. Laryngitis is inflammation of the larynx with accompanying hoarseness of the voice. Usually disappears after resting the vocal cords and treating any infection if that's what's the cause of it. Singers have to be careful with not straining their vocal cords too much, and they need to be using a technique which is not going to put too much strain on their vocal cords if they want to have a long career, that is. But most singers learn techniques now that usually doesn't happen. It's usually not a career-shortening sort of situation, and if they do occur, then just simply with resting the voice will usually just disappear after a period of time. Sinusitis is an inflammation of the cranial sinuses. These are the cavities that drain into the nasal cavities. And develops when nasal congestion causes a blockage of the sinus openings, and so therefore usually you'll have like a secondary bacterial infection that takes place there. So symptoms would include postnasal discharge, a headache, and facial pain, usually in the location where the sinus is affected. So treatment usually includes addressing the cause of the inflammation and restoring proper drainage. If a bacterial infection has set in, then usually antibiotics are required. Otitis media, this is another thing that is changing. The way that these things are dealt with has changed over time. Usually any kind of inflammation of the middle ear, automatically, antibiotics were prescribed. This is not the case anymore, in that, again, it was one of those situations that, can result in these superbugs by the over prescription of antibiotics. So nasal infection, they can spread to the ear by way of the auditory tubes or the eustachian tube that lead from the nasopharynx to the middle ear. And so symptoms will include pain, a sense of fullness, hearing loss, vertigo, and fever. And often does occur in infants. But they're not so quick anymore to prescribe antibiotics unless it's quite apparent that it is a bacterial type of infection. Just simply having some inflammation there, often they'll just let it run its course. Unfortunately, the child's a little bit uncomfortable for a period of time, but we have to be careful with the overprescribing of antibiotics. Sometimes, if it does become chronic, then the tympanostomy tubes they can be inserted to help drain fluid that might accumulate in the middle ear. So the lower respiratory tract, then the trachea and bronchi choking. This occurs when an object becomes lodged in the trachea. And the Heimlich maneuver is a very effective technique to help someone who is choking. I have seen it performed on somebody who actually was choking. It wasn't myself. I wasn't sitting. Um, Somebody else was sitting closer to the individual who helped them out. And it involves grabbing the choking person around the waist from behind and forcefully pulling with both hands into and up in an up direction in their upper abdomen to help expel whatever is lodged in there. So the Heimlich maneuver has saved many lives, and it's one of those things that is good for everybody to know. Acute bronchitis, inflammation of the bronchi. Symptoms include a cough that brings up mucus or pus. It's usually preceded by a viral infection, which has led to a secondary bacterial infection, and usually needs to be treated with antibiotics. Chronic bronchitis, this is where the airways are inflamed and they're filled with mucus, and symptoms then include a cough with usually bringing up mucus, and also known as the smoker's cough, because the most frequent cause of this is indeed smoking. And smoking causes the cells with the cilia to lose their normal cleansing action. It virtually paralyzes the cilia, which means that they've lost their ability to remove debris from out of the lungs, and hence you get that chronic smoker's cough. Asthma is a disease of the bronchi and the bronchioles. Symptoms include wheezing, breathlessness, and coughing. This situation where a person's airways are hypersensitive to irritants such as pollen, dust, animal dander, cigarette smoke, fumes, and we're seeing this more and more now, but perfumes as well. And what happens is the smooth muscle in the bronchioles, they undergo spasms when they're exposed to these irritants, and then the diameter of the airways decreases, and treatment requires drugs to dilate the bronchioles, and also other drugs to help control the infection, or sorry, the inflammation, I should say, inflammation. Pneumonia, this is an infection of the lungs and the bronchi or alveoli that fill with thick fluid, making gas exchange difficult. And symptoms, of course, include high fever, chills, headache, and chest pain. It's usually diagnosed with X-ray, chest X-ray. Can be caused by bacteria, viruses, or other types of infectious agents. Some types of pneumonia also affect individuals with reduced immunity. Again, before the age of antibiotics, many people died of pneumonia. In fact, my grandmother died of it. My mother was 11 when her mother died of pneumonia, actually. So, and you probably know of relatives too that before the age of antibiotics died of pneumonia. So, thankfully, with the age of antibiotics now, then many lives are saved. Tuberculosis, caused by a bacterium, Mycobacterium tuberculosis, and cells accumulate around the invading bacteria, which isolates them from the rest of the body and forms a tubercle. Um, However, this results in reduced elasticity of the lungs. So symptoms include coughing up mucus and/or blood, fever, fatigue, excess sweating, and chest pain. And treatment would involve a combination of drugs that includes antibiotics. Emphysema is a chronic and incurable disorder where the alveoli are distended and their walls are damaged, and this leads to a decreased surface area for gas exchange. So what happens is you get 10, let's say 10 alveoli, and they burst, and it becomes just one large alveoli. Well, you've reduced the surface area by nearly tenfold in that kind of a situation. And not only that, but it loses the elasticity of the lungs as well. So what happens is a person is not able to exhale easily. So they actually have to forcefully uh, try to push the air out of their lungs when it should be just simply a passive kind of um, procedure. We have to contract muscles in order to inhale, but exhaling should be just a passive process. And in these people, they actually have to forcefully um, expel air from their lungs. And again, it's also associated with smoking. Cystic fibrosis is it's a genetic disorder, and the defective gene, it codes for cystic fibrosis conductance transmembrane regulator. So this is a protein needed to transport chloride ions out of epithelial cells of the lungs. And so when for people with this genetic situation, um, they're not able to do this, and what happens is you get water which is not able to be transported out of the lungs, and so it leads to thick mucus secretions that clog the lungs. It can also affect other organs in the body as well, like for example the kidneys, and so it's not just a situation that that is restricted to the lungs actually. Usually, a lung transplant is required at some point to hopefully prolong their lives a little bit, but it definitely is, for the most part, a life-shortening kind of situation. Anybody that's dealing with this. Pulmonary fibrosis is fibrous connective tissue that builds up in the lungs, which causes a loss of elasticity of the lung tissue. And so it restricts the ability of the lungs to expand during inhalation now. And this leads to a decreased vital capacity. So it can be caused by a number of things. For example, asbestos and silica. So you probably heard the terms asbestosis and silicosis. And it's these particles that can set up this kind of a situation in the lungs. Coal dust also is another one that's associated with this kind of thing. So here's a diagram of most of these situations here that we've just talked about, a good summary of those. And then we'll just mention lung cancer as well. It's still the leading cause of cancer deaths in the adult, and 85% of lung cancers are associated with cigarette smoking. So with smoking, the cells lose the mobility of the cilia, which means that they can't clear the debris out of the lungs, so dust and dirt will settle into the lungs. Not to mention a lot of the materials from the smoke itself, which settles into the lung like tar and things like that. So cells with an atypical nuclei then appeared, followed by a tumor, which consists of disordered cells and atypical nuclei. And these cells, they replicate out of control, and so that's when a tumor gets takes hold. So these cells then they can break loose and spread to other tissues where you get metastasis. Treatment can include a pneumoectomy, in which a lobe or the entire lung is removed, and if it's determined that there has been any spreading, then chemotherapy and radiation are often required as well. Here's a lovely photo on the right of a lifetime of smoking and what that results in. And it's kind of ironic that the only good-looking cells in there are actually the tumor cells, which ultimately led to the death of that particular person. But you can see the difference in lung tissue from a smoker and a non-smoker, and this is the result of smoking. And that will end our discussion then of disorders of the respiratory tract.